And doctors warn that Ontario's healthcare system is being overwhelmed in this latest wave of COVID-19. The provincial shutdown is now in place, but many health experts question if the measures will be enough to curb the spread of the virus. And joining me now is infectious diseases specialist Dr. Susie Hota. Good morning, Dr. Hota. I have to get your feedback first on this latest round of restrictions and shutdowns. I know that Ontarians are growing frustrated having to keep going back into lockdown, but will this be enough to first lower our daily numbers as we're seeing vaccines rolling out?
Yeah, sadly, I don't think so. And, the idea of a shutdown absolutely makes sense. We need to try and use public health restrictions as best as possible to try and get things under control as we continue to roll out vaccination. However, the kinds of restrictions we have in place are really not that different from what areas like Toronto have been in since the end of November. And, we've seen surges in cases since then. So, I worry less about things like small gatherings that are outdoors. I worry less about small businesses. I have a few individuals coming in and out, but it's those areas where we're still allowing people to be congregating in larger numbers, especially indoors, like, certain types of businesses that are open for us to continue functioning, factories, things like that, that really worry me. That we're not doing enough to try and curb that transmission.
You mentioned factories right there. Should we be doing anything when it comes to schooling? I know parents are just waking up, getting their kids ready for the day. What do you think we should be doing when it comes to schooling? Should we be moving them online, especially as we're seeing these concerning variants also spreading?
At some point, we have to think about that. And whether we've reached that threshold is a very difficult decision to make. My whole feeling around schools is we should be doing everything else possible to control transmission around schools, because that's what introduces the cases into the schools. Transmission within the schools themselves has not been as big a problem as the introduction of cases into schools constantly, because there's pressures around in communities and rates of transmission in those communities are high. So, I do think it's a bit of a chicken and egg situation. We have to figure out, at some point you tip over a balance, and yes, it's not safe to keep the schools open. I prefer to take the other approach of let's do everything else to protect those who are in schools, including the teachers, including the students, as well as the communities that are around the schools, so that we can keep them open.
And Dr. Hota, I have to ask you, you mentioned, restrictions that we need to put in place. Let's talk about vaccine, because that's really the glimmer of hope for a lot of us here. What are your thoughts on vaccine distribution so far? Are they getting to the people who need it most at this point?
It's been a priority-based distribution sort of strategy, and that's the right way to do it. We have to kind of sequence through things because we can't just open it up to the masses, although I'd love to be able to do that. We just don't have the capacity to do that or the supply to always allow that. But, I do think that the epidemiology's changed, and the way that we've approached things up until now has been very much based upon, who's most harmed by this. And now that we're seeing younger age groups and people who don't have some of those comorbidities that we looked at before getting this and actually landing in hospital and ending up in ICUs, I think we need to start looking at how we actually get to those individuals quicker, and target areas where young people have to go into work, into settings that are less safe, so we can protect them as best as possible.
And these are the essential workers that a lot of the ICU doctors over the weekend have mentioned. Dr. Hota, what are you seeing or hearing when it comes to ICUs?
Oh, yes, it's definitely changing. The ICUs really worry me. We haven't seen them this full of COVID-19 patients ever, really, through this pandemic. And so, I just don't really know what what it's going to look like 2 weeks from now. Everything we're seeing now in the ICUs reflect what's occurred transmission-wise in the last 2 to 4 weeks. So we're really just at the beginning of this, and these variants of concern have resulted in 100% increase in the risk of ICU admission if you get, COVID-19 compared to an infection with, something that was not considered one of these variants. So it's really a different beast. Mm-hmm. The system can take care of some of it by moving around patients and trying to distribute so that, there's a spot to be cared for. But at some point, we'll run out.
Okay, Dr. Hoda, thank you so much for joining us this morning. We appreciate it. I'll hand it over now to Dina and Sid.